It's time for another ICU shift recap. Start off by getting report. I was working bedside this day, so I had 2 patients. So I got report from the offgoing nurse, and then I sat and reviewed the patient's charts for a little bit, looking through their labs and doctor's notes and imaging, anything that would be pertinent. Then I got started right off the bat, 7:45, checked patient number 2's blood sugar, gave meds, turned oral care, peri-care, and then I did all the same stuff to my other patient right afterwards. Down and charted around 8:45, and then went and got myself a breakfast burrito. At 10 and 10:15, I turned both of my patients, and then I braided my patient's hair because it was really long and they had just gotten their hair all like messed up, so I brushed through it and braided it. And yeah, also I should mention I had a nursing student with me this day, so she was very, very helpful in helping me do all these things. Once we finished with the braiding, we started doing the patient's next assessment, meds, turn, oral care, and then did all that same stuff to patient number 1. And then I sat down around noon to chart. At 1300, patient 1 needed some meds, turned them again, and drew some labs. And then at 13:30, I went and did some meds and a turn on my other patient. At 1400, patient 1 needed more meds and a tube feeding change. And then at 14:30, I went ahead and took my lunch. When I got back from my lunch, I did a meds, turn, oral care, blood sugar check on patient 1, and then pretty much did the same stuff on patient 2. As you can see, my patients were requiring a lot of the same things, so I pretty much was just a robot. 16:30, patient number 2 needed their tube feeding changed, and then patient 1 needed some more pain meds, so I went and gave those. At 1700, I gave some more meds for patient number 2. Again, 17:30, more meds for patient 1 and a turn. I know, you're probably like, why aren't you clustering your stuff? But like, things were getting ordered, and like, if I have the time to give things like exactly on time, then I'm just gonna do that. At 1800, patient number 2 needed some more meds and a turn, and then I went ahead and emptied my Foleys and finished my charting and just wrapped up everything at the end of my shift. And now I'm back for some more fun. So I hope you guys enjoyed my ICU shift recap, and I'll see you in my next one.